Our region's business is sponsored by PNC for the achiever in you. Our region's business, improving our economy, creating jobs, and strengthening communities. Innovation, collaboration, transformation, and the people making it happen. Join us as we take a closer look at our region's business. Now, here's your host, Bill Flanagan.
Today on Our Region's Business, two of our region's biggest names in the dairy business join forces. And a few tips for all of us regarding stress at work and in life. Don't manage it, embrace it. But first, Pennsylvania's newest healthcare insurer is gearing up to enter the market. Pennsylvania Health and Wellness is a managed care organization owned by Centene Corporation, the nation's largest Medicaid and long-term care insurer. Eric Lisle is President and CEO of Pennsylvania Health and Wellness. Good to have you here.
Thanks, Bill. Very glad to be here.
Yeah, welcome to Pittsburgh, too, because you're based in Camp Hill, right?
I am, but I have lived in Pittsburgh before, so I moved to Camp Hill from Pittsburgh.
Oh, okay. Very good.
Yeah.
Okay, well, obviously, you're new to Pennsylvania. Most folks here probably don't even know your parent company's name.
That's right.
Yeah, what exactly is Pennsylvania Health and Wellness all about?
Yeah, so Pennsylvania Health and Wellness, as you referred to in your opening introduction, is a subsidiary of Centene Corporation. Centene Corporation is the name that nobody's really ever heard of because we introduce subsidiaries into various states, and we have a very local approach to doing healthcare.
So they do business. Pennsylvania is Pennsylvania Health and Wellness.
That's right.
Similar in other
states. Sunshine State is Florida.
Oh, okay.
Superior Health Plan in Texas, and that sort of thing. So you don't hear much about Centene, but Centene is the largest provider of Medicaid, long-term care, and marketplace solutions across the country.
Okay, so then where do you fit in the vast world of healthcare and insurance and all the rest of it?
So Centene and Pennsylvania Health and Wellness is very focused on one particular segment of the population. We only serve the underserved populations, the low-income population. So we focus on Medicare products, LTSS products. We work very closely with the state as it relates to serving those communities. Our focus is very local. As opposed to, you think with a big national company that you'd be focused, on a more national scale, but we take that expertise that we get from and learnings from other states, and we take them in a local way into the communities that we serve, because we feel like those communities need individual attention and some individual touch, and we very much focus in those areas.
So for folks who don't know how Medicaid works or whatever, these people are not dealing directly with the federal government to get their health care. They're going through an insurance company or an intermediary.
Yeah, that's correct. We're an intermediary with the state. The state contracts with us, and then we provide services by partnering with providers across the state to the members that we serve.
Is this a crowded space in Pennsylvania? What brought you all here?
Well, it is crowded, but we do have some expertise that I think is probably unique to the state of Pennsylvania. Like, as you mentioned, we're probably the biggest expert in long-term care services. We do that in more places than anybody. And so when the state started talking about bidding out that service and contracting that service, we became interested in coming in and delivering that for the citizens of Pennsylvania.
And so how does that work? What is the sort of the long-term care service that's provided in Pennsylvania? Yeah,
long-term care services is really interesting. It covers services such as nursing home, in-home care. It even adds add-on services, so it's more of a population health focus as opposed to just a medical piece. We provide services such as extermination services for members who need that for their housing to have a healthy place to live. We even provide beautician services in some cases, just to make things cleaner and healthier for people. It's something that I think a lot of people that have been talking about public health for a long time have been embracing, the fact that there's more of a holistic approach to members' health.
No, yeah, that makes a lot of sense. Now, you just started signing people up, right, this month in Pennsylvania?
Yeah, that's correct. That's correct. We just started on the 2nd of October for this particular product and also for our Medicare products.
Okay, and so then the coverage would begin after the first of the year. Is that the way it works?
That's exactly how it works.
Yeah, so, and where you're out of Camp Hill. Now, we have a presence across the state in terms of employment, or is it mostly concentrated in Central PA?
So we actually employ people where our membership resides, but we have major hubs. So we have about half of our employees residing in Camp Hill. About a third or 40% of them are in Pittsburgh, out in Robinson Township. And then we have another home for folks out in Philadelphia that's yet to be built, but we're going to have folks out in Philadelphia. And we really look to focus on hiring people in the communities where their membership exists. So in the poorer communities, that's where we go to try to find the folks that are going to serve those communities.
Really? So what will those folks do for you? What kind of people are you looking for out of those communities?
They're service coordinators, they're in-home health aides and things of that nature. So they're actually going into the homes of the members that we serve to help provide services for them.
Oh, okay. So there's a lot of outreach associated with this.
Absolutely.
It's not like I just, you send in your check or whatever, or call somebody to call the insurance company, we need a service. You're actually out there.
We're in there, we're helping them with care plans, we're trying to help them get their lives on track and make sure that they're living in a healthy way.
So a lot of this is really as much about wellness as it is about intervention when somebody gets sick.
Absolutely. The long-term care program in particular is all about wellness. Having a healthy environment and wellness.
How long has Centene been around?
Centene's been around for over 30 years.
Okay.
And we continue to grow. You might have just seen on the news, we just acquired a health plan out of New York. So now we're sitting in the 5 largest states and one of the largest players in the 5 largest states.
Okay. So if people want to find out more, do they do it through the state? How do they find you if they fit into the populations that you
so
serve?
they could go to our website or they could go to the state website. They could go to PennsylvaniaHealthAndWellness.com, or they could go to Centene, or they could go to the state long-term care Community Health Choices website to learn more information.
All right, fascinating stuff. We're all trying to understand as you're in a very fast-changing, evolving, revolutionizing industry, and great to have a little bit of a lesson here. Thank you so much,
Bill. It's
Eric Lisle,
great to be here.
Pennsylvania Health and
Appreciate
Wellness.
it.
Thanks
Thank
a
you.
lot. Yeah,
appreciate it.
Next up, big deal in the dairy business as Turner acquires Coltryon, the last dairy in the city of Pittsburgh. Stay with us.